with student Dr. Ansert.
How are you? I'm Krista. Nice to meet you.
Nice to meet you. So what brings you in today?
Well, I've been experiencing some heel pain for about like 3 weeks now, and it's getting really unpleasant, so I figured I'd come in and get it checked out.
Okay. And you said it started 3 weeks ago. Was there any sort of trauma or anything that happened that it started, or it just kind of?
No, it just kind of came out of nowhere, so.
Okay. Can you point to exactly where it hurts?
Yeah, it's on my right foot. It hurts right here.
Right there. And it's just on your right foot, it's not on your left foot?
No.
Okay, great. How long does it hurt? So when the pain starts, does it hurt for like 10 minutes or throughout the whole day?
It kind of goes throughout the whole day. It starts in the morning, and then when I'm walking around, it kind of tends to go away or decrease a little bit, and then if I'm standing on my feet too much, then it really starts to hurt back up again.
Okay. And what kind of pain is it? Is it like a sharp pain or a dull pain?
It's a sharp pain.
It's a sharp pain. Okay. Do you try and take anything to help it, or have you seen anybody about it?
I mean, I tried taking some ibuprofen for it, and I guess that does some help. But yeah, I just try to keep my feet up when I get home. That seems to help.
Okay. Does anything make it worse? You said standing for a long period of time kind of makes it continue.
Then when I hop out of bed early in the morning, right away,
that first step
hurts a lot. Yeah.
Okay. And does the pain radiate anywhere? Does it go up the back of your leg or go to your toes?
It doesn't radiate too much. I guess it would radiate around like the heel area and the bottom of my foot, but nothing like up here or anything.
Okay.
Like that.
And so you said it hurts worse in the morning, and then if you stay on your feet, it kind of continues, but if you stay off your feet, then it gets better.
Mm-hmm.
Okay, great. And how would you rate the pain on a scale of 1 to 10?
Well, in the mornings, it's definitely like a 7 or an 8, I would say. It's pretty sharp. And then walking somewhat throughout the day, it would go down to about a 4. And if I've been standing for a while, which sometimes I am, it can get back to like a 7, I'd say.
Oh, okay. So then what I'm going to do now is I'm going to ask you a couple of questions about just you, so that way I can kind of get a better idea of what's going on down here.
Okay.
Sound good?
Yeah.
Have you ever had any hospitalizations at all?
No.
Okay. Have you ever had any major illnesses, like when you were an adult or in your childhood or anything like that?
Nothing major. I had the chicken pox when I was a kid, but that's about it.
Okay. And have you been able to have your immunizations like the regular ones that everybody gets?
Yeah.
Okay. Any weird immunizations at all?
Mm-mm.
Okay. Are you on any medications right now?
Nothing major, just birth control.
Okay. Do you have any allergies?
Yeah, to Compazine.
To Compazine, okay. Have you ever had a blood transfusion?
No.
At all? Okay. And what is your emotional state like now?
I feel fine, yeah.
Okay, great. So I'm going to ask you a really personal question that I ask everybody. It's nothing personal to you or anything like that. What is your sex life like?
It's normal. I practice safe sex. I've been with my boyfriend for about 4 months now, so nothing out of the ordinary.
Okay. How is your sleep schedule?
Pretty normal. I try to get as much sleep as I can. I'd say about 7 hours a night for the most part.
And do you smoke or use any sort of tobacco products at all?
No.
Okay, great. What do you do for a living?
I'm a dentist.
You're a dentist? Okay. Are you able to exercise with that busy schedule?
Yeah. I mean, I try to do as much as I can. I would say I go like 5 days out of the week to the gym.
Okay. Do you drink at all?
Just when I'm out with friends or at a work party or something like that, but nothing major, maybe a glass of wine at dinner.
Okay. What is your diet like?
Well, right now I've been trying to keep it low carb and somewhat healthy for the most part. It can be tough.
Yeah, no kidding. Tell me about it.
Yeah, I'd say it's pretty normal.
Okay. Is there any drug use at all, or like home remedies, over the counter, anything?
No, just when I get a headache, I would use ibuprofen or something like that.
Okay.
That's it.
Okay, do you have any pets?
No.
Okay. And you said you're dating somebody, so you're single, but with a boyfriend?
I guess, yeah, we're not married or engaged or anything of that sort.
Okay. And do you travel at all?
Not recently, no.
Okay. So what I'm going to do now is I'm going to do the physical exam, and I'm going to just kind of take a look down here.
Okay.
So first, I see that you have normal hair growth. It doesn't seem like you have any lesions or any swelling up here, which is great. Don't see any lesions back here. Everything feels normal, which is great. Moving down here, there's hair growth down here, so that means you're looking pretty good down here. There's no maceration in between your toes. The nail color and thickness, from what I can see, because your toenail polish is beautiful, it looks normal and everything looks fine there.
Okay.
I don't see any lesions down here. I see a couple of calluses. One is under here and on the side of your foot right here. And then same with this foot, you've got one here and one here. But other than that, everything looks fine. So now what I'm going to do is I'm going to check your vascular. And so your temperature is warm to warm all the way down, which is great. Check your pulses here. And they're 2 out of 4, which is normal. And then check your posterior tibial pulses. And those are also normal. But just to be safe, I'm going to check your popliteals just to make sure that they're still doing what they need to do as well. And though that one's normal, so let me check this other side real quick. And that one is also normal. And then I'm going to check and make sure that your toes are getting enough. And your cap refill is also normal. It's less than 3 seconds, which is great. So now what I'm going to have you do is I'm going to check your muscle system. So I'm going to have you push up against my hands.
Okay.
Good. Now push down. Great. And push out. And then push in. Okay, great. And now I'm going to have you lie back and I'm going to check your calf.
Okay.
So, all right. So I'm going to have you extend your leg out. Perfect. And I'm just going to push up against your foot and see if we can get, if there's any tension in your calf. Okay. So it seems like it's pretty tight and I'm not getting a whole bunch of dorsiflexion. So what I'm going to do is I'm going to have you flex your leg and see if I can get any more. How's that? And we get a little bit more, but your calf seems pretty tight.
Okay.
So I'm going to check your other one just to make sure. Okay. Okay. All right. They're pretty tight on both sides. So usually that means your calf is tight and that you have something called equinus. So what I'm going to do now is I'm going to go and talk to my attending real quick. We're going to try and see what we can do about that heel pain, okay?
Okay.
Okay,
Thank
thanks.
you.